It was a cold, chilly night at my grandparents' house in Kaduna. I was getting my hair done when I heard an ear-splitting, blood-curdling scream coming from my mother's room. Panicking, I thought armed robbers had taken over the house. But nope, turns out it was just my sister. Apparently, a big black scorpion had stung her foot. My mom, uncle, and I decided to take her to the hospital. And when we got there, they said there was a particular medicine that was unavailable. That same night, we went to 5 different pharmacies, and they all said it was unavailable there as well. Feeling worried and disturbed, I decided to check Healthline, a credible healthcare website known for their own healthcare, on what to do when a scorpion stings you. And what it said on the article was just shocking. Apparently, all we needed to do was elevate my sister's leg and use something cold to numb the pain. While I was reading through the article, my mother also decided to call a doctor she knew, and he pretty much told her the same thing. So we went back home, and I kept on thinking about, had I checked the website before we left the house, or had my mom called, we would have avoided the time, the cost, and the risk of our own safety. Ladies and gentlemen, this brings me to my own topic for today, healthcare innovations, and exploring the future of healthcare from telemedicine to its medical advancements. But have you heard of the term telemedicine? Well, telemedicine started in the 1970s, but was officially acknowledged by Thomas Bird, and it was gotten from the word tele and medicus. Telemedicine refers to healing at a distance, or rather, providing healthcare to people who live in remote areas through technology. While furthering my own investigation on telemedicine, I came across something called the Omnipod. This thing is used to check your insulin levels for people who have type 1 or type 2 diabetes, or even just check your blood sugar level. And I find this incredible. God forbid we ever get diabetes anyway. Another thing I found out while I was doing my own research was something called online psychotherapy. How many of you here are confident enough to say I've spoken to a psychologist? Hands? Exactly. But how many of you here are comfortable with the fact that someone knows that much information about you? Studies have shown that in Nigeria, most of the stigmatization around medical health or mental health awareness is due to the fact that people are uncomfortable with people knowing that kind of information about them. So with online psychotherapy, all you have to do is pick up your phone, speak to a psychologist you've probably never met, and talk about your mental health in your own solitude. Easy, right? But for me, the main reason we need telemedicine in Nigeria is because right now, we are medically understaffed. Looking at the statistics, it shows that in the UK, the current ratio of doctors to patients is 1 to 350. And even at that, the NHS is complaining that they are overworked. And in Nigeria right now, it's 1 to 5,000. So it's not fair on the patient or the doctor himself. Everybody knows that when it comes to medicine, when doctors have either pressure or make mistakes, people could get killed. Ladies and gentlemen, I hope you see the reason we need telemedicine. So I leave you with this. Try to understand the technology around you, favor it, because we need it as much as it needs us. Thank you very much.